Hello everyone, this is Jeffrey with Dr. Bill Clearfield at the Clearfield Medical Group.
You forgot your last name?
Yes, I did. So we are at
That would be
the
Jeffrey Munson.
Doctor Shop?
Dr. Bill's doctor.
Dr. Bill's Doctor Shop. So what are we talking about today?
We're going to talk about head injuries
Okay.
and hormone disruptions.
Head injuries and hormone disruptions?
Yes.
So does hormone disruption come from head injuries?
Yes, they do.
Really? All the time?
Well, about 50% of the time.
Okay.
And it appears to be one of the missing links in how we take care of, especially our soldiers, with that have suffered these head injuries.
Okay.
Okay, because they come home and they're depressed and they have all sorts of behavioral issues. There's a million vets are incarcerated, making bad choices.
Okay.
There are 22. The official rate is 22 suicides a day.
Really?
In the veterans, and we suspect it's more. That's the official rate.
So are they? I mean, don't they just say it's PTSD?
Okay, so PT.
Whatever I said, I'm a dork. I'm not a doctor.
So PTSD is kind of is kind of a throwaway term. If anything goes wrong, you have PTSD.
Oh, okay.
PTSD is an anxiety issue. It's not physical. It's easy to say, okay, here's your bag of pills, here's your PTSD pills, go away, don't bother me anymore. Okay, but it does nothing for any type of physical or hormonal disruptions.
Okay.
So, and I kind of fell into this accidentally. We had one of our vets showed up here one day and said he was kind of down and out. He really wasn't even a patient. We're right next door to a big gas station here, and he was getting gas, and he saw our sign on the door, and he came in here, and he was kind of scruffy looking, and not doing too well, and I don't know, we kind of hit it off, and so I started asking him some questions, and in my naivety, I said, that sounds like a testosterone deficiency. He's depressed. He's 40 years old. His muscles have all gone to pot. He hasn't shaved in 20 years. He's sleeps half the day away.
Oh, wow.
He's got all sorts of anger issues, and he's just kind of he's just kind of what they say out in Reno here, gnarly all the time.
Okay.
Right. Mm-hmm. And his bones are really broken. Walked down the steps and broke his foot.
Really?
Just bones are brittle. He was gaining weight. He was 250 pounds. He was 5'8".
Really?
Gained 100 pounds. He said he was cold all the time. What hair he had come out. He had no eyebrows. He had no fingernails.
Really?
Yeah.
And no other doctors that he talks to? He
goes to the VA, and they tell him he's got PTSD.
Okay.
And they give this cocktail of pills, and he was taking 23 pills at one time, and he's had every diagnosis you could think of: high thyroid, low thyroid, high cortisol, low cortisol, fibromyalgia, chronic fatigue, and nothing was working. So. In my again, like I said, with my simple brain, we're all about hormones here. I said, gee, it sounds like testosterone deficiency. Sounds like growth hormone deficiency.
Okay.
So we got some labs on him, and sure enough, 40-year-old guy's got a testosterone of 80. Now that's the total. Now
What's it supposed to be?
For 40 years old, we should be at least 500, 600.
Are you kidding me?
No.
Wow.
His thyroid numbers were off the charts, and if you know anything about it, so the TSH, which is the one thyroid number, the only one we're supposed to look at, was 175, and it should be 0.5 to 3.0.
Really? And
and low is high. And that's an inverse.
Okay.
The low is high, high is low. So
Okay.
that was off the charts. Growth hormone, he had none. Vitamin D, he had none. He had 6, which was what you see in Wilkes-Barre. And
wow.
our little Wilkes-Barre ladies in the middle of January.
Wow.
So we one thing I didn't do was kind of just smother him with everything. We went slowly. We gave him one at a time, and we gave him very low doses because somebody that low, it's going to be a real shock to the system. Sure. And he slowly got better. He started growing hair.
So do I know him?
Yeah, you do know.
Is it Joel?
It's Joel.
Oh my gosh,
Yeah.
I would never have guessed that. I know who Joel is. He's a great guy.
And you guys know who Joel is too, because he's been on our other videos.
That's right. And I didn't realize that. Wow.
Yeah.
He's come a long way.
Oh yeah, yeah. So he's on.
Wow.
You know, he was practically homeless. I think he was in jail a couple times.
Oh.
He's bought himself his own place now. He's on
great.
5 veteran outreach programs.
Oh, that's great.
We've sent him to San Diego to speak. About us.
Really?
Yeah.
Wow, that's
At the
great.
Rad Fest, which is coming up again this summer. So he's really come a long way. And then he brought a couple of his friends, and we have kind of a couple of different groups. The ones who are doing well are kind of the more headstrong ones, the ones who kind of want to break out. If you just kind of lay in there and say, well, this is my life, those guys, well, they usually don't show up here anymore.
Oh, okay. Yeah.
Okay.
Yeah.
And then we have some ladies too, some women too. So we found some themes or some things that run through that are similar. And so now I have a kind of a checklist of what to look for.
Okay.
So before we get to that though, turns out that there's an outfit out of San Diego called the Millennium Warrior Angel Foundation.
Okay.
And they've been doing this kind of work for about 10 years.
All right.
And they've come up with a protocol, and they actually have a certification course and exam, which I passed 2 weeks ago.
Very good.
Today
Congratulations.
is April 5th,
Yeah.
2018. So I passed that 2 weeks ago. So I'm actually certified by the Warrior Angel Foundation in traumatic brain injuries and with hormone displacements.
So, are you working with the VA here in?
We're working around the VA.
Oh, okay.
So they're not too receptive yet.
Okay.
But I think the more we see more and more, the more and more we have exposure, and the more and more successes that we have, hopefully they'll become a little bit more, receptive.
So before we wrap it up, because we gotta wrap it up. So how would someone know? I mean, how would they know first of all?
A lot of times you don't know. A lot of times you don't know.
Obviously, hormone issues don't come just from traumatic brain, but injury. So what would be something if it would happen to me? Just a basic, say I was skiing, I got a concussion, that type of thing?
Yeah. Mm-hmm.
So it could be anything that I had an accident where, would you have to have had a concussion for it to be an injury?
No, in fact, that's one of the keys is that you do not, the severity of the injury, it does not matter.
Oh.
The hormone disruptions don't happen right away.
Okay.
It takes 3 months. Could be a year
Oh,
later.
wow.
It could be 2 years later.
Oh,
Could be
geez.
5 years. So it's actually been documented up to 17 years after the injury that you can relate it back to the injury. Yes.
Okay. So
these folks with behavioral issues and the lashing out. You see these guys screaming at the sky and whatnot.
Right.
So those are the guys that we need to get to.
really.
Yeah. Mm-hmm.
So if someone is been told they had PTSD, and things aren't helping, aren't getting better, they should contact you.
Yes.
Okay.
Yes, that's kind of one of our missions in life.
Okay. All right.
So what we found is that 56% of all traumatic brain injuries end up within 1 year have a hormonal disruption.
Wow. Okay.
And 2 years, without doing anything, 36% of them still have hormonal disruptions.
Wow.
Okay? The first hormone that goes is growth hormone.
Okay.
And so growth hormone deals with mental clarity, strength, energy. It's an anti-inflammatory. It's good for skin tone, sexual energy, sexual desire. It's kind of like the holy grail. Yes, It's the HGH. It's what the athletes abuse. Okay.
And so people can buy that HGH stuff.
Well, you can buy
online
precursors and stuff. The
Right.
real thing first of all, it can be a little bit dangerous.
That's what I was, yeah.
Yeah, we don't use a whole lot of it. In fact, very little of it. The problem with growth hormone is that it overwhelms your system. It's sort of like the blobs, and it shuts off your natural growth hormone.
Oh.
When that happens, if we stop it, you have a rebound.
Oh.
And there really isn't an antidote for it, and the stuff's about $1,000 a month retail.
Wow.
So we don't want to do that to anybody.
Sure.
But there are great precursors. There are great substances. Some of them are injectables. Some of them are actually sprays. Some of them are over the counter that you can use that will stimulate your body to make different portions of the growth hormone.
So what is this stuff where you hear on like ESPN or whatever radio stations that you hear these advertisements like men are your testosterone? What is that?
Well, those are usually herbal remedies or supplements.
Okay.
So
I don't know any names off the top of my head. It doesn't matter. We don't need that. But when people hear those commercials and they think, but even if it was HGH, or I haven't heard them say growth.
Well, HGH is highly regulated, so it wouldn't be that.
Okay. So but they say it is, and so it's not really.
Huh?
Because when I hear the commercials, when they talk about human growth, okay,
yeah, it's not.
Okay.
Okay.
And you shouldn't take that without a doctor's.
HGH, no, you need to be really careful.
Yeah, so do you guys catch that?
Yeah, I mean, HGH, the usual dose is 0.8 to 1.2 units, about that much, 5 days a week.
Okay.
And so the athletes were using that much, and it is growth hormone. It does tell hormones are messengers. It tells your body to grow.
Right.
Okay, so you and I don't grow up anymore. We
That's
grow out,
That's
right?
True. That's
so
true.
you get too much of that, you're going to grow.
Oh, okay.
First you get muscle, then you get fat, and then you get fluid, and then if you keep going, you're going to end up with a big problem.
Wow. Okay. All
So
right.
we don't want to do that.
Right.
That's the these folks have enough issues to deal with anyway.
Yeah.
But the precursors that we use, some of them are homeopathic remedies, some of them are pieces of growth hormone, the most important ones, they drive your body to make it. They don't suppress your natural growth hormone. And the nice thing is, if we stop these, you just go back to the way you were. Okay, you don't get a rebound. You're not dependent on it.
Okay, so do a quick recap for about like what someone who has these symptoms that they should consider giving you a call.
Okay, so the things that we're going to look for are behavioral issues, sexual dysfunction, things like your temperature, your hot and cold intolerances, substance abuses, and suicidal ideations.
Oh, okay.
Those are the main ones that we're looking at.
Okay. So catch that. If you know anyone who has this issue, it doesn't have to be just military.
No.
But,
we see lots of civilians also.
Yeah. So give Dr. Bill a call. The phone number's below. So everyone, it's been really interesting talking about this. So there's a lot of problems that people don't even know about. You're right. They just pacify it and go, oh, here's your pills.
Right. Exactly.
So take care of yourself and take care of your friends and the people that you know and love that have this issue. Talk to them and get them to get a consultation with Dr. Bill. And everyone, have a wonderful, wonderful day, and thank you for watching this, and be a good human. All right. Thank you very much. Bye.